Namaste viewers, welcome to the Facebook live session. Today our topic for discussion is all about testicular cancer, and for our discussion we have with us Dr. Sanjai Addla, consultant uro-oncologist at Apollo Cancer Center, Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Sanjai Addla is specialized in treating urological cancers and have experience of 21 years. Welcome doctor, welcome to our Facebook live session. Starting with our first question. What is testicular cancer?
Thank you very much for the invite and hope you all find what we are going to discuss of interest and it will improve your understanding of cancer in general and testicular cancer in specific. So answering the first question, what is testicular cancer? I would probably make it a bit more broader and say that any lump that is felt in the scrotum should be considered as testicular cancer until proven otherwise. If I wanted to be more specific, I can say that any cancer that develops in the testicle is a testicular cancer. But for a lay person, you would not understand the difference between whether it is arising from which part, either the testicle or the behind the testicle. So I would say any lump that you feel in the testicle, in the scrotum, is a testicular cancer until proven otherwise by a specialist who has done some imaging, who has done some examination of you, and then say that this isn't anything of worry. So my sincere advice would be, whenever you feel a lump in your scrotum, please consider it as a testicular cancer unless proven otherwise.
What are the symptoms of testicular cancer?
So as with any cancer, you will always have symptoms in the early stages and symptoms in the later stages. Symptoms in the early stages, as you would understand, simple is any lump that is palpable in the scrotum, especially in the testicle, is a testicular cancer. So that's the first symptom. Normally these are painless. You just have a lump in the testicle without any other symptoms. It is a cancer in the testicle and has to be ruled out, rather than thinking that this is some hydrocele or something that is not cancerous. So earliest and the only symptom of local presence of lump in the scrotum is testicular cancer. What are the other late symptoms? In case if the cancer goes to the abdomen, normally the testicular cancer spreads to lymph nodes in and around the kidneys. You can have lump as a swelling of your tummy, or in some cases it can go to the lungs, in which case you might start having shortness of breath, in that you are finding it difficult doing your day-to-day activities, and rarely you can have lumps in the neck area because a testicular cancer can go up to there. So earliest symptom is presence of lump in the scrotum. Late symptom is symptom of cancer having spread elsewhere, and that would be symptoms of metastasis.
What are the causes of testicular cancer?
As with majority of the cancers, we don't know what actually causes testicular cancer. There is always a hereditary element involved, in that, let's say your dad had a testicular cancer, or your brother had a testicular cancer, there is a high probability you might end up having testicular cancer. So that's one risk factor. The second risk factor is if you were born with what we call as undescended testicle. The testicle normally grow up in the abdomen, in the tummy, and then by the time you are 2 years old or at the time of birth, they come in and then they are there in the scrotum. So if there is any problem in the way they come down, or they are held up along the way somewhere, we know that there is an increased chance, up to almost a factor of 20 to 30 times, of developing testicular cancer. So these are the two risk factors. However, we know that there is a worldwide difference in the incidence of testicular cancer. Scandinavian countries tend to have a higher incidence of testicular cancer, and if you believe the cancer numbers as such coming out of India from the cancer registry, the cancer of testicle seems to be lower, as in it is lowering, which I'm not sure what to make out of, but we know that there is a worldwide variation in the presentation of testicular cancer, indicating that there are some environmental factors that are at play causing testicular cancer. So commonest is hereditary, the second common is some environmental factors, and of course the common theme for all these things would be history of cryptorchidism, wherein the testicle hasn't come down into the scrotum in the normal way.
Does testicular cancer require surgery? How successful is testicular cancer surgery?
Almost all, okay, and I'm categorizing saying that almost all means around 99% of testicular cancers do need surgery. What surgery, what is the extent of surgery is always determined by what is the stage of the diagnosis of the cancer. So quite often when we catch a testicular cancer in an early stage, they do need an operation, generally done on the scrotum, done through the groin, but you pull up the testicle and do the operation called as orchidectomy, wherein we remove that testicle out. And quite often that itself can cure the patient of the cancer. However, if the cancer has gone higher up, mainly into the lymph nodes, patient will end up needing chemotherapy, and following the chemotherapy as well, he might need further treatment in the form of surgery, what we call as retroperitoneal lymph node dissection, in that you following chemotherapy, you go back and remove wherever the disease might be there, so that you are preventing the chance of it coming back.
What are the side effects of testicular cancer?
So again, there won't be any side effects of the cancer as such, as in if let's say if the cancer has gone to the lungs or anywhere else, you will feel generally weak. But the side effects of the treatment of testicular cancer are again dependent on what actually we do for the patient. So let's say we do a surgery in the form of just removing the testicle, generally doesn't have that much of an impact on the patient, because there is another normal testicle that can look after the patient with respect to sexual activity as well as ability to father a child. So surgery doesn't have that much of an impact. However, if we do higher surgery, as I mentioned before, what we call as retroperitoneal lymph node dissection, here we can impair the nerves that allow a person to have a successful sexual intercourse. So it might have an impact on ejaculation, not on the erection but on the ejaculation. The more or the well-known side effects of testicular cancer treatment are mainly related to chemotherapy. The standard chemotherapy for testicular cancer, especially when it has gone higher up, is what we call as BEP chemotherapy, which is bleomycin, etoposide and cisplatin. And these have got what we call as a specific side effect. Bleomycin affects the lung to a significant extent, in that they will struggle to breathe, and there will be some scarring that is there in the chest for a long period of time in some patients throughout their life. That limits their physical activity. And if you look at the cisplatin element will have an impact. Of course, they will have a loss of hair, and we know that there can be an impairment with respect to the kidney function. Though this is transitory, we know that it does have an impact. So these are, chemotherapy is always about what we use, what dosage we use, and we know what are the side effects associated with that. Saying that, if you take example of, there are quite a few athletes who were diagnosed with very advanced testicular cancer and they made a successful recovery. Our own hero Yuvraj Singh had a testicular cancer that spread to his lungs, and after that he went on to have surgery, he went on to have chemotherapy, then went on to play for India, and of course father a child. So they can go back to their normal physical self, mental self, as well as biological self. So if it is managed well enough, there are not that significant long-term side effects.
How long does it take to recover from testicular cancer?
So it is again variable depending on what sort of a treatment. So quite often if we catch it early and we treat it early, patients tend to take about a week off and then go back to their work. However, if we have caught it in a later stage, of course during the time when they are having chemotherapy, they will need to be off work, and it might take another 6 to 8 weeks after they have finished the chemotherapy for them to feel normal. So I would probably think about 3 to 4 months if they have got advanced disease, and about 2 to 3 weeks if they have got localized disease. So that would be the time period they need time off work, or you can say that's the time period it takes for them to recover their own normal self.
Do testicular cancer grow back after treatment?
So as with any cancer, any cancer. You take lung cancer, you can take skin cancer. These are all biological processes that are affecting firstly that testicle, and there are some changes happening in the other testicle as well. So there is always a probability that a cancer can come back. The probability might be smaller, but rarely, if ever, is zero. The reason for that is, firstly, we are talking of very young people. We are talking of men who are in their 20s and 30s, and they've got 50, 60 years ahead of them. So just because of the long lifespan they have ahead of them, there is always a probability that they might have recurrence of the cancer. The further you go from the primary treatment, the less is the chance of this cancer coming back, but it never goes back to zero. That's one. Second, again, the chance of recurrence will depend on what is the stage of the presentation, how was the response to the treatment, and what was the grade of the tumor. All this will help us, of course, inform the patient as well as change the investigations that we are doing, so that if there is any evidence of cancer recurrence, we can catch it early enough.
At what age is testicular cancer most common?
So it tends to be what we call as bimodal. So if you look at early 20th, as in from 20 to 30 is one peak, and then late 30s to 40s is the another peak. Because testicular cancer, they seem to be what we call as a non-seminomatous germ cell tumor. NSGCT tends to be earlier, and seminomatous germ cell tumor seems to be late 30s to 40s. So these are the two bimodal increased risk of developing testicular cancer.
Thank you, doctor. Coming towards our last question, doctor, could you please tell our audience about the facilities provided at Apollo Cancer Center, Apollo Hospitals, Jubilee Hills, Hyderabad?
Just coming to our center in Apollo Hospital, Jubilee Hills, I've been here now for almost 6.5 years. Before that, I was in England for almost 19 years. I would say that the facilities that we are providing here are top notch, similar to what you would get in any international oncology centers. That's one. Second, managing any cancer, as with any disease, it is not just an individual, it is a team that manages a cancer, because it does need that many people managing those cancers. So you need a medical oncologist, radiation oncologist, surgeon, access to technology, firstly to diagnose, monitor and treat these patients. And what we have in Apollo is not only the equipment, but the staff trained to use those equipment with the expertise as good as anywhere else in the world.
Dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Sanjai Addla and clarify your doubts. Thank you, doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.
Thank you very much. Namaste.